Hey guys, I hope everybody is doing well, surviving as best they can right now. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we are going to go over exercises for knee arthritis. So one of the things that we usually talk about in the videos is kind of how knee arthritis isn't always the cause of the knee pain. So just again, be aware that just because you have arthritis or were diagnosed with arthritis or arthritis shows up on an x-ray, it doesn't always mean that's where the pain is coming from. Arthritis pain is generally continuous, meaning it doesn't matter if you go up the steps, down the steps, wake up, it's always going to be there. And that's because your arthritis doesn't change from the time you wake up to the time you go to bed. You have an arthritic joint when you wake up in the morning, you're going to have an arthritic joint when you go to bed. So it is not always the cause of pain for that knee to be diagnosed with arthritis. A lot of times it could be the surrounding muscle joints, it could be another joint entirely causing that knee pain. And because when we are talking about the knee, and we get this question a lot in here because we work the hip and we'll work the ankle when somebody comes in and is complaining of knee pain, you can't really let the knee go or just kind of focus on the knee without focusing on the hip and the ankle. And that's only because all the muscles from the hip come down and attach there, and all the muscles from the foot come up and attach at or near the knee. So you can't really rehab the knee, or you can't do exercises for the knee without exercising the hip, without exercising the ankle. So it's really important to understand that there are muscles that are coming from above and below, and just to focus on the knee joint isn't really going to be helpful. Doing exercises, and this is a lot of times where people run into a lot of issues with knee pain, is they wind up not doing anything, and they wind up in too much pain, and they wind up stopping. Oh, rest is going to fix it. Rest is not going to fix knee pain. Unless you have fallen and cracked your knee, and there's a specific traumatic event that occurred, rest is not going to help your knee. So don't take 2 weeks off thinking it's going to get better. It's not. All right? Now, while you may take 2 weeks off and you're like, oh, she doesn't know what she's talking about, it feels so much better. Yeah, the inflammation will calm down, the pain will go away somewhat. You haven't done anything for 2 weeks. But the minute you start to put stress on it again, the minute you start to run, the minute you start to walk, you go up and down those steps, it's going to come back. And a lot of times it comes back even worse. So when we talk about exercises, and the exercises I'm going to go through tonight, they're designed to not make things hurt. So it's not a no pain, no gain situation, because you want to keep that knee moving. But it's really important, and that's not just at the knee, that's at the back, that's at the hip, that's at anything. Rest is very rarely the answer, unless it's a traumatic injury, unless you fall and know exactly how you did it. Resting in a joint, a muscle, is only going to cause you more issues down the long run. So be aware that it is not advised to not do anything when your knee hurts. You want to make sure you're taking some proactive approach. If you aren't sure what you should be doing, we offer free consultations. All you have to do is call our office at 215-997-9898, and we'd be happy to get you in. But if you figure out what to do, it can save you a lot of issues in the long run. People often ignore knee pain also because they're so afraid of surgery. And I can tell you that probably the majority of people that come in here with knee pain don't require surgery. So don't be afraid of getting help because it's going to require surgery. And actually, the inverse is true. If you don't get help, you will most likely need surgery. So most of the things that happen at your knee can be fixed without surgery. But if you let it go on and you let it go on, it's going to cause you to require surgery. So if you know that knee's been bothering you for a while and you haven't dealt with it, stop ignoring it, because it can cause you to have surgery in the long run if you don't deal with it when it happens. So be aware of that, okay? Don't just sit and rest. Don't ignore it because it's too scary. Surgery might scare you. Most of the time, you don't need surgery, okay? So know those two things. Also, when you have knee pain, you have a very high probability of limping. And most people think when I say limping that they would notice. So they're just gonna start dragging their leg, or you know, when we talk about limping, we picture somebody who isn't putting weight on that leg or has a really, you know, dragging that leg behind. Most limping isn't like that. Most people that we see here have no idea they're actually limping. Your body can change certain little elements about your walking without you even knowing it. And before you know it, that knee pain is now hip pain, it's now back pain, it's now, I don't know where all this pain in my leg came from. We hear that a lot. I don't know where this pain came from. It's all up and down my leg. So if you have knee pain, you're going to start to change how you walk. It is inevitable. Your body will do this without you realizing it. You may walk with a stiffer foot. You may drop your hip a little bit. You may not put as much weight. You may bend your knee a little less. All of those things play into knee pain and hip pain and how it all interacts together. So that's why the more you ignore it, when you rest it, you wind up taking a little bit of the inflammation away. You don't solve anything. You're going to go right back to that limp and probably cause yourself some back pain and some hip pain and things like that. So knee pain is not something that to ignore. It's not something to write off just as arthritis. Even though we're going to go through knee pain exercises for arthritis, most of us have it. I have it. Everybody has it. You get your knees x-rayed, you're of the age of 18, and you've lived a full life. You definitely have some sort of knee arthritis, but most of the time that has nothing to do with why you have knee pain. So be aware of that too. It's not just something you can write off and say, oh, well, I have knee pain because I have arthritis. I went to the doctor, he x-rayed it, oh, I know I have arthritis. Not always the case on why you have the pain. You're not disputing the fact that you have arthritis, not always the fact on why you have pain. So one of the most important things you want to know when you're dealing with your knee is keeping a full range of motion. And a lot of times, especially in the older population, as you get older, you don't want to move, you don't move as much. And unfortunately, a lot of times with COVID these days, not a lot of us move as much. So it's really important to keep the joints lubricated. And the more you're able to move, the more you're able to bend and straighten, the more fluid is going to go in and out of them, keeping your muscles nice and lubricated, keeping the joint nice and lubricated. So the first exercise we're going to do, and you can do these without weights, you can do them with weights, you can try them without weights at first and then add weights, is you want to just sit down in a chair, and all you're going to do is just kick your leg out nice and easy. Now, a lot of people like to cheat on this exercise and just go to here. All right, you want to go all the way up so that your knee is straight. You're going to start to lose range of motion at the end of the knee straightening and at the end of the knee bending. So when you're doing this exercise, you want to make sure you push it all the way out straight. If you don't have leg weights to add at home, you can just hold it for 5 seconds. All right, what you don't want to do is you don't want to be leaning back, so you want to have your back supported. All right, you don't want to be bringing your hip up in order to bring your knee up. You should be able to sit here nice and straight and extend your leg out. You're going to feel that in your quad. You're going to feel that in your adductor. Again, some of you may have weight. I see this done with weight all the time at the gym, and it's done completely wrong because people have so much weight on there, when really they should just put a little bit of weight, hold it out there for 5 seconds, slowly bring it down. You want to do about 30 of those on each side. You should get a good bit of fatigue by number 30. And if you want to make it more challenging for yourself, don't rest. So just keep your leg up and don't rest it on the floor. If it's too fatiguing, obviously just put that foot down in between each rep. But again, the main goal for this is that you start all the way back here, where your knee's in a complete bend, and you go all the way straight. If you can't bend your knee all the way, if you can't straighten your knee all the way, that's a problem that you need to have addressed. And again, we do offer those free consultations. Call our office at 215-997-9898. We'd be happy to get you in, but missing that range of motion at the end or at the end when you straighten it or at the end when you bend it is a problem. And if it's a problem, it needs to be addressed. The more range of motion you lose, the more painful your knee pain is going to become, the more painful your hip and ankle are going to become. The next exercise we're going to do is just kind of working the opposite muscle group. So you're going to do a hamstring curl. So again, you want to stand here. Now this is a good one to also try and work on balance, but this isn't a balance exercise. So you can have your hands at the counter, and I want you to kick your butt as much as you can and come back down. Now it's not this, that's a march. Most of the time when I see a hamstring curl, the knee goes in front and then you bend it up like this. That's not it. There should be no movement this way, okay? So your knees should stay perfectly in line. You're just gonna pick your leg up and curl it back. Again, a lot of people just like to do this. That's not gonna do a whole lot, all right? Just kind of let your leg flail. You wanna curl it up and relax it down. Nice and slow. Again, not a balance exercise. So you want to just do nice and easy. Curl it up and let it relax. Curl it all the way up. The stronger you get, the further you're going to be able to curl it. Some of you may actually do that a couple times and wind up with a hamstring cramp, okay? That's kind of a sign that you have some issues going on, that there is some weakness. Most of the time, these front muscles, your quads, are going to be stronger than those back muscles, those hamstrings. So, again, you want to do about 30 reps on each side, taking it nice and slow. This is not going to do much of anything, all right? To make it more challenging, you can add a leg weight. You can hold it at the top for 5 seconds. You can not touch the ground in between each repetition. Those are ways to make it more challenging without going to the gym. And again, that's one of the gym that I see done wrong all the time. People are arching their back and they're throwing their whole body into it, and it really isn't affecting the hamstrings whatsoever. You're straining your back. And the hamstrings, are attached right there at the glutes. So it's really easy to strain your back if you're not careful. The last exercise I'm going to show you is going to be for the hip. And again, we talked about how the hip muscles come down and attach at the knee. So it's important when you're talking about the knee to work the hip. If all you're doing is working the knee, you're not doing yourself justice, okay? And you're not going to solve anything either. So you're going to stand either hands on a countertop, hands by your side. Again, this can be used for balance. We're not going to necessarily use it for such, but if you want to, you're just going to kick your leg out to the side. Nice and easy, out to the side. If your leg goes up really high, that means you're coming in front, okay? We don't want to come in front. We almost want to go out and to the back. So you're just going to go to the side and a little bit back, nice and easy. Again, it's not this. You're not going to get anything out of this. But if you go nice and easy, all right, and a lot of times if you haven't done this for a while, you're going to make sure that your hand's on a surface. You want to make sure your toe is pointed forward. Again, if you're getting a ton of range of motion, you're either turning your toe out, okay? Not okay, all right? You want to make sure that your toe is pointed forward, you're angling your leg a little bit back, and you're going out. You're probably going to feel this more in the standing leg than you are in the actual leg working, especially if you're balancing on that leg. This leg will get sore. It's working both sides. Great exercise to do, and you're going to feel it in that knee. You shouldn't feel pain with these exercises though, so if they do hurt, you do need to seek medical treatment. This is not something you want to diagnose on your own. This is not something you want to push through. Those are very simple exercises that you can be doing, and if they're bothering you, you don't want to do them. You don't want to continue to do them and inflame the knee even more. If you or someone you know is having knee pain and wants a free consultation at our office, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.